Before we start with diabetic foot diseases, I would like to share this information about diabetes in India. The prevalence is almost about 65 million. So among the 65 million, about 6% of the patients will end up having diabetic foot disease. And among the 6%, 1% will always end up having amputation. Now if you look into these patients who have undergone amputation, they all start with a small ulcer which has gone unnoticed or probably has not been addressed adequately by surgical means. Now you would ask why the diabetic foot is so common among diabetics. It is because of the poor glycemic control. Second is the poor vasculature, the vasculopathy as we say. Third thing is the stiff joints which cause the problem, and the fourth thing is the diabetic neuropathy. All these collectively cause a problem which leads to the breakout and eventually comes to the point of amputation if not addressed adequately. Now, what is the role of plastic surgeons in diabetic foot? We at Sakra, we have a systematic algorithm that we follow when a patient walks in with a diabetic foot. Now, when they come with a small ulcer, the role of a plastic surgeon is to bring a good, adequate debridement. Now, once a good debridement is done, all the dead tissues are removed. Followed by that, we address the wound with a good negative pressure therapy, which is more of an advanced wound care system. Once the wound is good, we see according to the depth of the wound. If it is a small wound, usually it's a grafting that is usually done. If it is a deeper wound, then in that case we do more advanced procedures like free flaps. Now also in this diabetics, the most concerning factor are the stiffness of the tendons and the joints. Now say if this is the foot, what happens? The joints are all clawed down. So this leads to the imbalance in the pressure and leads to the wound breakdown. Now for example, when the patient has hammer toe, what is the procedure that we do is tenotomy for releasing the hammer. Now in cases of clawing of the other digits, again the tenotomy will take care. Now some patients will have a equinus deformity. This is because of the Achilles tendon tightening. In that case we do tendo-Achilles lengthening. In also procedures like Keller's arthroplasty for the stiff joints of the that is called as hammer toe. What we do is Keller's arthroplasty. So these are some procedures to mention that we do here at our hospital. So now by doing all these things at a regular interval, we can avoid the foot to progress to a greater degree of severity which leads to amputation. So if you see the foot of a diabetic, these are staged into 5 to 6 stages. The initial stage where it is just a small callus where fair modification is all that is warranted. Now coming to the stage 2 and 3, it is adequate debridement and adequate wound care system followed by grafting to flap based on the depth of the wound is what we do. Now the next one, if there is a bony involvement, like as already mentioned, it is the osteotomies that we do, the tenotomies that we do. So this diabetic foot disease, all I would like to say is it can be very well prevented by adequate glycemic control with good footwear modification, frequent assessment of the foot and early referral when the lesions are small to the designated hospital.